When we're talking about breast surgery, there's really three things we can do. Make the breast bigger, make the breast smaller, or change the shape. Breast augmentation uses an implant to make the breast bigger, and it's one of the most common procedures done in the United States. When someone's considering a breast augmentation, there's really a couple decisions to make in terms of where to place the implant, what incision to use, the type of implant to use, and the size of the implant. At SVIA, we typically use a breast crease incision, a dual plane dissection for placement of the implant. There are two main types of implants, silicone and saline, and the decision on which one to use is largely based on the patient. We use a tissue-based planning technique that takes into account the patient's own tissue and helps decide what size an implant would work well for that patient. Breast augmentation typically takes about 50 minutes to perform, and that includes from skin incision to closure. Patients will be marked in the pre-op holding area, so we decide where to make the incision. The anesthesiologist will bring them back into the OR, and the patients will be given some light anesthetic and won't remember any part of the procedure. We'll make an incision in the breast crease and using cautery make a pocket to put the implant in. Every case we use a Keller funnel so that the implant doesn't touch the skin and decreases the rate of capsular contracture for the patient. Everything we do is optimized to enhance the patient recovery and also enhance their outcomes. Patients are walking right away, but we do want patients to be careful for at least the first 3 weeks. They can start running at around week 2, but they really should wait a full 3 months before they do chest exercises because of the placement of the implant. Final results of a breast augmentation take about 3 months. Initially, the implants seem a little bit high, but they quickly drop into place, and at 3 months, you get your final result. Breast augmentation is a great procedure because you see immediate results, and the patient satisfaction is extremely high. Often, we have patients say that we've changed their lives, and they're extremely grateful for the service that we've provided.